About 1.5 million people in the U.S. have been diagnosed with rheumatoid arthritis. That's according to the Arthritis Foundation. And many patients experience flare-ups and chronic pain. But beyond pain medication, there are lifestyle changes RA sufferers can make to help manage their chronic pain. So Nick Turkas is the Senior Director of Patient Education and Community Connections for the Arthritis Foundation and is with me now to talk a little bit more about those changes. Because I think people, they know they can take a drug, but they want to feel empowered, like there's something that they can do that will help them. But let's start with the basics, though. Who's most at risk for rheumatoid arthritis?
Sure. So the people at most risk for rheumatoid arthritis are women within childbearing age. So ages 30 to 50 are the most common people affected with rheumatoid arthritis, but it can affect people at all ages, all genders, all races.
And, there's pain and there's pain, and I'm sure there's a spectrum, but how significant is RA pain for patients?
RA pain is serious pain, and many people living with an invisible illness like rheumatoid arthritis have a hard time communicating to those that they love how serious their pain is. On a 10-point scale, most people with arthritis are rating their pain at a 5 or higher every day. Every day of the week, they are living with significant pain. Even people that are working with their physician and have a medical management plan and are treating their pain medically, they still may have flares of pain that can really set them back.
And, when you're in pain, then you're less likely to move, and then that has an impact on other aspects of your health. So let's talk about what the options are for patients when it comes to managing their pain. What can they do?
Absolutely. I think that's an important thing that you just said. There are things that people can do. They can do things to manage their pain. We know that there isn't a cure, but as I said, pairing up with a healthcare provider or rheumatologist is one of the most important things that you can do to help medically manage your pain. But there is a self-care, a self-management, and the choices that we make every day to invest in movement, into physical activity, into fueling our body with healthy foods, keeping our body at a healthy weight, and working to control our stress can really help manage arthritis pain and keep those flares at bay.
And I guess there's another component too, right? It's the mental health component. It's not a fair comparison, but I know there's days where I have a headache all day long and I'm just miserable. Yeah, you can go through the day, but it's really sort of grating on your mental health, and it helps to have support. How does the companionship and connection play a role in helping alleviate pain?
Well, there is such a connection between pain, stress, and when you're stressed, your muscles get tight. And when you're tight and you're stressed, that can lead to mental health issues like depression and anxiety. And people with rheumatoid arthritis have a much higher rate of anxiety and depression than the general population. And you're right, there are things that we can do, and especially not just what I can do, but what we can do. So there's a community of people with rheumatoid arthritis. There's a community of people living with chronic pain, and they can band together and they can support each other. And the Arthritis Foundation has resources like our Connect groups, where we connect people with arthritis and with pain syndrome and create opportunities for them to connect and share. We have groups that meet online. We have groups that meet in person. So we always want to make sure that we let people know with rheumatoid arthritis that they're not alone, that this isn't something that they have to struggle with all by themselves, that we can lift each other up, and as a community, we can help provide solutions and tips and tools, and just have someone to talk to that gets it, that understands what they're going through, and that can really help a person along that arthritis journey.
Nick Turkas, thank you so much. I think this is valuable information. Reach out. There are people out there to help you and support you. Thank you.
Thank you for the opportunity. So appreciate it.